Recognizes the honourable member for Long Island.
Madam Speaker, I'm grateful to once again have the opportunity to rise on behalf of the wonderful people of Long Island, who I have the distinct pleasure, the privilege of representing in these hallowed halls. Madam Speaker, before I get into the meat of my contribution, I'd like to extend condolences to the families of a few of my constituents. The family of Mr. Edsel Arley, I extend condolences. And also to Melissa Dowell. Melissa is one of my key generals, a great supporter. And, you know, Madam Speaker, I'm a bit ashamed to say that I was unable to make her grandmother's funeral on the weekend. And so, Melissa, I sincerely apologize. We've spoken, and I told her I would take the floor and apologize the other day. And I will make it up to you, Melissa. And so to Melissa and the entire family, I extend condolences on the passing of her grandmother, Miss Flory Adderley, as well as on the passing of her cousin, Mr. Anthony Knowles. Madam Speaker, I'd also like to extend condolences to the family of Mr. Elwood Donaldson Sr., a founding father of the Free National Movement and one of the leading political minds that we've seen over the last 40 or so years. And so my condolences to them. A couple nights ago, Madam Speaker, a night or two ago, I got a WhatsApp message with some photographs from the member for South and Central Eleuthera, showing me that they'd begun the roadworks in Long Island. I'm very happy about that, and I thank the member for ensuring that he kept his word that the roadworks would begin before the end of January and during the month of January. I'd also like to note, Madam Speaker, that, you know, we have an ambulance in Long Island that was donated some time ago. And we've been trying to get that accepted. The member for Tall Pines, we were going back and forth trying to get him to come down to do an official commissioning more than a year ago. And sometime last year during the regatta, I determined, you know, we couldn't wait anymore. I drove the ambulance down to the clinic because they told me that they would accept it. And the nurse pleaded with me not to leave it. She was in fear of her job. She said because she couldn't accept it. We continue to seek acceptance of this ambulance, which was donated by Alive, because we constantly have to have mechanics look after it and or use money from the fund to constantly replace batteries and so on. So I think it's important that this ambulance is accepted by the government on behalf of the people of Long Island. Whatever inspections need to be done, they can do it. But certainly we need the ambulance because we don't need our people being transported when they're ill or dead in the back of a truck, in the bed of a truck. And so I'm going to be issuing correspondence this week to the minister, to the PS, and all of the relevant persons in hope that this ambulance will be accepted. They can take the responsibility of the ambulance onto themselves. This is a free ambulance being donated. Government doesn't have to worry about sending an ambulance to Long Island. Madam Speaker, I'm also, my constituents, particularly the fishermen and the boaters, you know, I'm from one of those fishing islands, one of the fishing capitals of the Bahamas, have expressed, firstly, we are grateful. Let's say that. We are grateful for the government deciding to reduce these ridiculous fees on licensing of these boats. Fishermen and persons who own boats can't keep up with fees that go from $20 to $700 and $1,000+. However, I was told by a boater, or a fisherman, I should say, a couple of days ago, that they, whilst the fees have been put back to their original course, the office on the island is still, there still seems to be some kind of confusion in terms of making payment. Right? So we'd like to have that looked into so that can be settled on the island, because there are persons who want to pay the fees, but there needs to be some kind of clarification to the offices on the island. Madam Speaker, over the coming weeks, I'm looking forward to being able to install 2 Omni LED solar installations that provide Wi-Fi on 2 parks in Long Island. These will provide lighting as well as free Wi-Fi for persons utilizing the parks. Madam Speaker, I too am concerned about the state or the scourge of violent crime that we are seeing happening over the last few weeks. Certainly, we are facing an unprecedented crime wave with almost daily murders of young Bahamians in particular, young Bahamian men and in 1 or 2 cases, Bahamian women. This destruction goes well beyond the physical death of an individual, but it affects multiples of individuals and children who must now figure out how to support themselves in the face of lost income, lost loved ones, and really have to, in some cases, seek state support. But the loss, sometimes they're losing the only breadwinner in the family. Our streets is running. The blood is running through our streets. In fact, so much so that the United States Embassy today issued a security alert. And it reads, the U.S. Embassy in Nassau advises U.S. citizens to be aware that 18 murders have occurred in Nassau since the beginning of 2024. Murders have occurred at all hours, including in broad daylight on the streets. Retaliatory gang violence has been the primary motive in the 2024 murders. And this is what they're telling their citizens as the actions to take. Actions to take. Exercise extreme caution in the eastern part of New Providence. Use caution when walking or driving at night. Keep a low profile. Be aware of your surroundings. Do not physically resist any robbery attempt. And review your personal security plans. And of course, they lay out their contact information for assistance. This does not bode well for the Bahamas. Madam Speaker, since the year's kicked in, we've had an average of nearly a murder per day. And many people are asking, what are the crime consultants being paid for? Where's the strategic plan? Many people are asking these very valid questions. We know that both murder and rape is up. Both murder and rape. Madam Speaker, as it relates to murder, we must look to amend legislation to have categories of murder: first-degree murder, second-degree murder, and so on. We've not, I think, adopting that approach could also lend to how we prosecute these crimes. Madam Speaker, Bahamians don't wish to hear about crime. Bahamians want to feel safer. We want to see action. We want to see action, and we want to see it now. Madam Speaker, right now, the business community is facing quite a challenge. We're seeing a business license debacle. It's probably the worst renewal exercise in history since business license was introduced in 1974. And I'm gonna, today's Tribune. In today's Tribune, you have noted accountants, Prentino, Albury, and Craig Gomez, lamenting the state of the business license renewal process in the Bahamas. And I adopt this. It says, businesses endured an absolute frenzy to meet Monday's VAT payment deadline due to continued growing pains with the Department of Inland Revenue's tax portal. It was revealed yesterday. Accountants in the private sector disclosed to Tribune Business that some companies struggled to comply with the stipulated timeline for filing and paying December's VAT collection because the new tax administration portal is not accepting electronic payments via the likes of credit and debit cards. Besides leaving many businesses fearing they could be hit with financial sanctions or penalties for not meeting Monday's deadline, concerns are also voiced by service providers that the situation is delaying the collection of due taxes by the public treasury and thus disrupting the government's cash flow and ability to meet its own obligations in a timely manner. Prentino Albury, the president of the Bahamas Institute of Chartered Accountants, he talked about some of the challenges that are being faced. And this is how the Tribune refers to him. Besides the difficulties paying VAT electronically via the tax portal, the biker president said other challenges related to the tax credits owed to companies are no longer visible, that the tax credits owed to companies are no longer visible in their statements. And they now have to apply and call for it. Some companies and service provider intermediaries are still struggling to log in and sign in with the uploading of VAT-related information provided, proving to be yet another concern. And this is Mr. Albury, and I'm quoting him, quote, "It just keeps coming over and over," Mr. Albury said, adding that companies are now unsure whether they are making tax filings and payments correctly because the system, which underwent an upgrade in December 2023, no longer consistently provides acknowledgments and receipts. So the business community is quite afraid that they are going to be sanctioned because of a faulty system that doesn't allow persons who want to pay VAT, who want to get their business licenses renewed, an opportunity to do so. A faulty system where persons are not being told, look, after the 31st of January, due to our system being at fault, you won't be sanctioned. And I think the government needs to speak to these people, to the business community, to assure the business community that sanctions will not flow from this system being down. Madam Speaker, we hear a lot of rhetoric about inflation and the cost of living in the Bahamas. And we see the rush to increase fees on recreational and commercial boat owners, which came, frankly, without consultation and needed to be reversed. We see the impact that this has had on fishermen and on recreational boat owners. I believe in the government's lust to tax. And we've all heard that taxation is the lazy way out. Sometimes they fail to consult, particularly with parties who might be most impacted, like the fishermen in my constituency. So, Madam Speaker, we encourage the government to immediately reverse its horrible policy decision to increase VAT by 100% on breadbasket items, on medicines, and other critical and essential everyday items necessary to support the most vulnerable among us. And we've advocated for the reversal of this horrible decision, this decision to increase VAT by 100%. Frankly, we see it as, in our estimation, hurting the poor as opposed to helping the poor. This doubles down because the poor among us are those who are the greatest consumers, and VAT is a consumption tax. That's the reality of it. That's the reality of it. And so, while it's a matter, Madam Speaker, the business community is also curious to know about the situation with the NIB rate increase. Businesses, business persons express that the business community is being held hostage because no one knows. We all want to know when will the NIB rate increases be published? Will it still take effect on the 1st of July, 2024? Or will it be extended? The business community wants to know. Madam Speaker, I also want to note that, I've gotten some concerns expressed to me, complaints from my constituents with respect to a bug and or COVID on the island. And I believe that we have to pay special attention to the possibility of an uptick in COVID on these islands, particularly islands like mine. I know there's a number of persons who are now wearing masks again because there are folks who have been taken to clinic or even had to come to Nassau because of the bug and or COVID. So I would encourage the Ministry of Health to see or to look into the state of affairs on the island. And whilst I'm speaking about health, we are in desperate need of medicine in the clinic. On both of the main clinics on the island, there's a serious medicinal shortage from high blood pressure pills to diabetes medicine to some of the very basic over-the-counter meds. And so we are calling upon the government, and more specifically the member for Tall Pines and the Minister of Health, to assist us in ensuring that the clinics on Long Island are not only properly staffed, but all of the essential meds are available to the people of Long Island. We always say we pay taxes like everyone too. Madam Speaker, I've always been a person who supported the idea of the Office of the Ombudsman, written about it in the past, and frankly, I do support the establishment of such an office. However, Madam Speaker, we must ensure that in establishing the Office of an Ombudsman, that it is not toothless, and that it is properly staffed, that it is truly independent. Because in the Bahamas, one of the things that we suffer from is political intervention. Madam Speaker, the Office of the Ombudsman, which is now a major part of legal systems in the United Kingdom, New Zealand, the United States, Canada, Jamaica, Trinidad and Tobago, Barbados, Dominica, Ghana, Namibia, various other countries. This has been an established office for quite some time. And I'm glad we're catching up with the way of the world. There's a professor, a UWI professor by the name of Albert Fierjo, and his seminal works, Commonwealth Caribbean Public Law, in that he talks about this important auxiliary as a backup to the constitutional protection of the fundamental rights of citizens of a state. These days, Madam Speaker, we note that the average Bahamian does not have access to justice or simply cannot afford lengthy litigation. So what we do have...
The chair recognizes the honourable member for Tall Pines.
Yes, I was in the precincts when the member for Long Island made some references as it relates to the Ministry of Health. I want to assure the residents of Long Island that sometimes the Ministry of Health, when medicines are forwarded, there could be delays in shipment. And I heard his cry, and I want to assure the residents of Long Island that they are not being neglected, no other clinic throughout the Commonwealth of the Bahamas. He also made reference as it relates to COVID-19 and the fact that people are leaving Long Island. I'm not sure if I really listened to it, but also I want to let him know that at our clinics throughout the archipelago, there's a mask mandate, which means our healthcare professionals and clients, when they come to our clinics and hospital, must have masks. The reason why that's important is because we have a shortage of medical staff, and we know COVID has never left the Commonwealth of the Bahamas. It's here. It's something that we live with, and we have a strong surveillance unit that is on the ground in all of our family islands and in New Providence, where we are constantly monitoring cases as it relates to COVID, particularly those who are symptomatic and those who are unvaccinated. Thank you. I want the residents to know that as it relates to vaccination, our centers are open. We encourage individuals who have not been vaccinated to access our vaccines because we understand those who are vaccinated and who become symptomatic are less likely to shed the virus versus those who are unvaccinated and symptomatic. And this was a similar matter that happened in Inagua the other day. I have already clarified it with a press release and spoken to the media this morning as it relates to it. And so there's a lot of clarity as we move on as it relates to COVID-19. But I do not want it to go on record that as if there is an epidemic in Long Island as a result of COVID cases. COVID is in the Bahamas. That's a fact. It's everywhere. It's in every country. But the World Health Organization and the Pan American Health Organization made it very clear it is not of an epidemic proportion, and we are monitoring these things very closely with our National Reference Lab and the gene sequencing capabilities to know exactly which strain, how much of the strain, and look at influenza A, B, and RSV virus, which is also prominent. So not everyone who have a cough and cold has COVID. We have a very high incidence of influenza A and B. Thank you.
Thank you, Honourable Member.
Madam Speaker, I thank the member for his response. However, I never said there's an epidemic, nor did I say that anyone at the clinics weren't wearing masks. What I said was that there is an uptick in persons on the island either having a bug or COVID-19. And there are persons who are coming to the island through Nassau, leaving Long Island because there's not adequate medicine in the clinics. Diabetes meds, high blood pressure meds, various other meds, and I encourage you to liaise with the staff on the ground in Long Island to see what is there. I'm speaking from what is happening there on a day-to-day basis. Persons are going to the clinic, they cannot access medicine, okay? There's a need for the clinic to be properly, both of the clinics, the main clinics, to be properly stocked with medicine. I also spoke, you mentioned a surveillance unit. I'm unaware of a surveillance unit being in Long Island, okay? That is not, I'm unaware of that. I'll yield.
We have a surveillance unit that is in Grand Bahama, New Providence, and the surveillance unit responsibility is to all our family islands. And so there is a key personnel on the island who correspond with our surveillance unit. Every incident that takes place in the clinic as it relates to infectious disease has to be reported and it has to be monitored. So there is a system in place. There may not be a specific unit, but the system is actually in place to monitor infectious diseases throughout the Commonwealth of the Bahamas at our clinics, in the community, as well as any resort or any of our ports of entry. It is in place.
I'm happy to hear the system is in place, and so now I would invite this unit, Tall Pines, to come down to Long Island to see what the situation is on the ground, because there are complaints and concerns about this flu bug as well as COVID on the ground, all right? And I'm serious about ensuring that the health and welfare of my people are preserved, my constituents are preserved, and that is looked after. And of course, there's the issue of the medicine, which I hope that you would assist in addressing. I will speak to you again. I will send you a letter, reference the ambulance, and accepting the ambulance. That is something that is of great importance to my people on the island.
We have been in discussions with the donor of the ambulance. I wouldn't call names. And we are in the process of accepting that gift. We know exactly where the ambulance came from, and we know the philanthropic group who are responsible for the ambulance. And so the PHA, Philanthropic Board, as well as myself, are in communication with the donor of that ambulance to accept the gift. But you don't just drop the ambulance at the clinic and we accept it. It has to go through a philanthropic arm of the PHA.
I appreciate that. We've been going back and forth with this for quite some time. And you know, when your people need something, the only way sometimes is to move in a way that can be appreciated, where we deliver it to you. This ambulance has been on the ground now for some time, and we have been servicing the ambulance and ensuring that the ambulance is maintained. And so we'd be appreciative to know a timeline on when this ambulance would be accepted for the use of the people of Long Island. Madam Speaker, I note that, Madam Speaker, I need another 2 minutes to finish, please. Madam Speaker, with respect to the Ombudsman and the Office of the Ombudsman, I believe that the implementation of this office should be a part, or I believe that one day maybe we should move when we do a constitutional reform to include this office in the Constitution. I believe that such an office assists with protecting Bahamians. It assists with protecting persons from victimization. And I encourage that this office is not only independent in name, but also independent in practice, in that it has its own budget, and that this budget is subject to increases dependent on inflation and yearly assessments, that it doesn't have to go to the Treasury or some other entity funding, that it is properly staffed with well-qualified, meets its mandate, which is in the interest, which is, you know, they have 3 such offices where you deals with the public utility issues, such as intervening in disputes relating to utility companies, excessive utility bills, incorrect billing, defective meters, disconnections, the unavailability of services, inadequate street lighting, illegal phone calls, etc. You also have a political ombudsman in Jamaica, and this individual deals with all political matters. And then, of course, you have a parliamentary ombudsman who deals with matters concerning the government and statutory agencies. And so, Madam Speaker, I support the bill and the move to implement this office. I believe that an ombudsman would address injustices sustained as a result of a fault, whether in administration, due to bias, neglect, delay, arbitrariness, discrimination, incompetence, turpitude, and that this person would be able to investigate or look into local authorities, look into the public service, look into local government, as prescribed by Parliament, inclusive of anyone who holds public office. And so, Madam Speaker, with those few words, I rest, and I thank you.
Thank you, Honourable Member.